For over 30 years, Urban Baby Beginnings has been the leading nonprofit providing community support services specifically for pregnant and parenting families in Virginia. Our mission is to reduce adverse outcomes and decrease isolation experienced by families during the prenatal, postpartum, and early childhood years by increased access to maternal health hubs which provide community support, workforce development, and advocacy for birthing and postpartum families.
Last year, Urban Baby Beginnings and the Virginia Neonatal Perinatal Collaborative were awarded a 5-year grant through Hrsa, which is the Human Resources and Services Administration. The grant was titled the State Innovation Award. The two organizations really came together to think about how we were going to implement the strategies for strengthening community-based care, hospital systems, and facilities. And we do that through a maternal health task force, which was formed last year as well.
A requirement of the grant was really to ensure that this was a collaborative process with a strategic plan through the task force. And so we have several partners. Mainly we have community partners, nonprofits. At the table, we have nurses, we have providers, we have professors represented at the table, really to ensure that we are engaging a large group of individuals. The third main accomplishment for this grant is an actual innovation piece.
And the innovation is Urban Baby Beginnings Maternal Health Hub. So we're really excited to be around the table.
The most recent report states that over 80% of maternal mortality deaths are preventable. And of those preventable deaths, over 50% of them occurred in that postpartum period, meaning after they have already left the hospital and are residing within the community. Community is essential to getting this work accomplished. We know that a lot of the solutions exist within the community, and we're able to, through this grant, really elevate the voices of community and ensure that they are represented and heard as we work towards system level change.
If we look over the last year in terms of our data and the 1,400 moms that we have surveyed, things start to change when they're hospitalized. When they're hospitalized, 76% of moms stated that they needed to be connected with the hub because they had a need for some type of service and support. So that means they needed to get connected to a care coordinator who was able to walk them through what it meant to get support like mental health services or, getting access to a blood pressure cuff could be something, the actual physical things that moms need. But it also alluded to the fact that over 50% of our moms were high risk. You have safety issues when you don't have a coordinated care model such as the hub to support those moms. When we started looking further, we saw that moms were looking for mental health supports. They were looking for access to primary care physicians because the primary person that they were seeing was their OB, but when they were sick or needing some care outside of their pregnancy, they were using the ER. Close to 80% of moms did not understand their insurance benefits and were really asking about what they needed to do to get connected to their insurance companies. Lastly, just having a connection to a social support network like the doulas and community health workers is one of our driving forces to why we have to have these coordinated care models within the hospital systems. Urban Baby Beginnings represents a movement that families have really been pushing forward, really focusing on what it looks like to change the type of care that people receive. I think about one young family and they said, you know what, when you become pregnant or you just have a baby, you really have to seek for care. Like, no one comes to you and says, hey, you're pregnant, now you need to do all of these things. And it tells us that we need to do something different because it's such a special time. To know that you can come to a local hub, to know that that hub has connections to hospitals and quality providers and people who are socially connected to you, and to have a sense of belonging. It can do wonders, not only for your mental health, for your pregnancy. It's why we see better outcomes for people when they're engaged with the hub. So we can't ignore that something like this structure, this infrastructure, this change that moms are really pushing for matters to them. When you invest in the hub, what Hrsa recognizes, when you invest in strengthening systems of support, you're investing in future generations. And that's what we're pushing for here. We know this matters. We know we can do it. The grant that we have today is helping us continue to build. It's building already on many years of work. We're really excited to do this and honored to be able to do it because it really took a lot of trust in us for people to really push forward and say, hey, this is really the next thing that we need to do here in Virginia. So we take this very seriously. We want to make sure that when we come out of this, that moms are actually getting the care and services that they need, and the hubs play a part in that.